All right, hey guys, we're here today. We're going to be establishing a peripheral IV on our patient here. Her name is Ivy Needed, and so we're gonna go ahead and get started. First of all, I'm going to make sure that throughout these procedures I'm administering all of my meds with the 6 rights, patient rights in mind, being the right patient, the right dose, the right time, the right route, the right med, and the right documentation as well. So in order to get started, I'm going to first check my doctor's orders and the MAR. We have a doctor's order here for initiating an IV of 0.9% normal saline, 1,000 milliliters, and he would like it to be infused over 6 hours. So we're going to make sure that we have all of our materials here. I have my solution. I definitely want to make sure that it's not expired. I want to make sure it's the right color. I want to make sure there aren't any particulates in the bag, and that the bag is intact and we're good to go to use that. And then I'm gonna also want to make sure that it's the correct solution for the doctor's order. So once I kind of get that in order, I'm going to create a label for my bag. On that label, I'm going to make sure that my drop factor is listed. In this case, it's going to be about 28 drops per minute over 6 hours. We're starting at about 105, so it'll be done about 7:05. So basically the way we calculated it out was the drop factor here is 10 for the tubing, which is 167 milliliters per hour, leaving us with about 7 drops per 15 seconds, or 28 drops a minute. So with all that being said, I'm going to go ahead and open my solution. Maybe. Again, probably making sure the bag is intact after you get it out of its protective covering, and again looking for particulates, etc. And I'm probably not going to throw this label on there until I get it hung, so that I get it hung at the correct level. I don't know if I mentioned on this label that you're also going to want to have the patient identifier, room number, date, time, obviously that we started it, my initials, and then the lot number of the IV. So we're going to go ahead and I guess from there we can hang this. We're gonna hope that stays there. Okay, so go ahead and apply my label. I'm gonna put it on the back side so that you can see the label on the front of this, just in case. Okay. We're just going to do that. So then I'm going to go ahead and make sure that I've identified my patient in the room. If she can identify herself, I can verify with her medical record number. But there needs to be 2 different methods of identification for her in order for that to be all right. So I'm going to explain my procedure to her, explain to her that we're going to go ahead and start an IV, tell her why, ask if she has any questions, and before I get too carried away here, make sure that all her questions are answered. And then I'm going to go ahead and get my tubing set up. The biggest thing with this tubing is just making sure that you maintain the sterility of the ends. So with this, I'm gonna make sure that I have my tubing clamp so it doesn't drip everywhere after I spike it. Make sure my valve is closed. And I'm going to go ahead and make sure that this is clean. I'm just going to go ahead and wipe this off. I did just take it out of its sterile covering, but I just want to make sure we're good there. So, making sure I have all my things closed, I can go ahead and spike the bag. And then I can go ahead and fill my drip chamber. About halfway. Okay. I want to make sure there's no air in my tubing, so I'm going to go ahead and just uncap the end, again maintaining sterility, and I'm going to go ahead and unclamp. Prime my tubing, get all the air out. There we go. Okay. So I've already calculated my drop factor. And so at this time I could go ahead and set my drop factor on my tubing if I wanted to. Which I think we calculated at. So 7 drops every 15 seconds. So I can go ahead and do that. I'm gonna use a timer or a clock, put the second sign on it. My nurse friend over there is gonna tell me when 15 seconds is up or when to start.
Go ahead.
Okay.
That's 15.
So probably about there. You wanna do it one more time?
Sure.
Okay.
Ready?
Yep.
Start. And stop.
Perfect. We are right on. Okay. So then after we do that, we can just clamp this off so that we have that all ready to go and we get the patient's catheter in, and then we can just get it started. Okay. So making sure to maintain sterility on the end. I'm going to make sure that doesn't touch the ground. Make sure we've got the cap on and everything. It's all set and ready to go. Okay, so we're going to go back to our patient and again make sure they're the right patient and they're identified, and then we're going to go ahead and place the IV catheter. So I'm going to wash my hands really good. I also did that right after I walked into the room the first time before I started messing with things. So I'm going to wash my hands again, and I'm going to go ahead and approach my patient, go ahead and look at their, in this case it's her hand. See if I can identify a good vein. I'll use my tourniquet. Normally you'd want to place it anywhere from 4 to 8 inches above the site that you're looking at. However, we don't quite have that amount of room on our patient. So I'm going to put it up here as far as I can. And you want to make sure that's good and tight, but not too tight. And in order to verify that it's not too tight, you would want to palpate for a radial pulse. Make sure that it's not too tight. If it's too tight, you need to loosen it up a little bit. You still want some blood flowing. So in this case, we're good to go. So I found a really good vein right here. All looks really good to me. So I'm going to go ahead and make a mental note of that. And I'm going to undo the tourniquet while I gather my supplies. I'm going to be using a 20 gauge IV catheter needle. You know what I forgot to do is label my tubing. I have it pre-filled out with the date and the time that I'm hanging it, as well as my initials. So I'm going to go ahead and get that done before I forget it. And these are good for 24 hours. Wrong date on the tubing, but we're, for the sake of the video, pretending that it's the right one. And once I have all my supplies gathered, I can go back to my patient, wash my hands again, and I'm going to go ahead and throw some gloves on here. I'm going to locate my vein again. Go ahead and place the tourniquet. Nice and snug. But again, not too snug. So I have my vein here. I'm gonna use an alcohol pad. Maybe. Make sure that site is really good and clean. And then I like to go back and feel again with my finger right before I put it in, and then in order to stabilize the vein. So I'm gonna alcohol my finger and keep that clean while I'm opening my supplies so that I can use that finger again later. I'm gonna go ahead and get these opened up. I have some gauze and dressing. And my saline lock here. And then my catheter. So I'll go back and okay, fingers still clean. So probably before I do anything, I'm going to want to loosen the end of the catheter a little bit so that it can be easily pulled from the end when I'm ready to insert the catheter after I've gotten that situated. So I can go ahead and uncap my needle, and I'm gonna go ahead and down from this site, I'm going to stabilize my vein by pulling down on it. And then I'm going to go ahead and at a 30 to 45 degree angle, I'm going to go ahead and poke. Okay. Then with this hand, I can go ahead and advance the catheter and pull out on the needle. Go ahead and safety that. Discard of my sharps. And I want to make sure that the catheter is in the vein. Definitely before you insert completely, you want to identify that you have a flash and you're in the vein, and make sure that, I would definitely take that off before I actually inserted anything. So at this point, I want to make sure that this stays stabilized, and then I can go ahead and what am I doing? Flush. Make sure that no, not flushing. I'm gonna go ahead and do this first. Can we pause?